Making sure that you know the right content for your medical school interviews is so important. This means you actually have the confidence to be able to answer questions. If you want to take that step to make sure that you know your content and you can answer your interview questions in a really effective manner, make sure to watch this video. In this video, we're going to be covering organ donation, the opt-in system, the opt-out system, and how you can talk about this in terms of the ethics for your interview so you can ace that med school interview. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship, and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. First, taking a look at what organ donation actually is. This is when an organ is given to someone via a transplant because they need that organ. This can be done as someone who is living can give up a certain organ for somebody else, but most commonly, organ donors are often from people who have passed away and their organs are used for others who may need an organ transplant. In organ donation currently, there are many different challenges that are presented. The first is that there is a shortage of organs. Essentially, there is a very high demand for different organs that need to be required by patients, but there's not enough supply for these. Additionally, when an organ is going to be used, it has to be decided if it's viable or not. Sometimes after a patient passes away, their organs may not be viable due to the way that they've passed away or due to different concerns relating to that organ. And additionally, there has to be matches between a patient and a donor's organs in order for there not to be rejection. Additionally, often BAME communities are at higher risk of having longer waiting times for organ donation, again because of the lack of suitability of different organs available. This can make it really difficult for organ patients who are awaiting this organ transplant and can actually affect their care too. Now, there are 2 potential systems that could be used for organ donation after an individual has passed away. The first is something called the opt-in system. Now, an opt-in system would mean that a doctor would ask a family and that patient if they would like their patient's organs to be donated and to be used in different organ transplants for other patients. Now, in this situation, it's always the patient's wishes before they pass away that is taken into consideration, even if the family's wishes are different. However, if the patient has not stated so, then this can be passed on to the family. An opt-in system means with that after this, patients would actually have to register, or the patient's family would register to say that yes, they are okay for their organs to be used for organ transplants in other patients. The second system that could be used is something called the opt-out system. What the opt-out system says is that there's presumed consent already, which means that after anyone has passed away, it's presumed that they are essentially okay to give up their organs for them to be used in organ transplants. However, as it's an opt-out system, individuals or their families have the choice to actually remove themselves off the organ donation register. Now, as you can imagine, both of these systems, they have positives and negatives as to why they're used. In England, the organ donation bill states that in this country, this system is an organ opt-out system. So there used to be an organ opt-in system where individuals and the patient's family, for example, they would have to opt in and tell doctors that yes, they are okay for that patient's organs to be used for organ donation. However, under the organ donation bill, this has been swapped over to an opt-out system, and there were many reasons for this. Now, the reason an opt-out system was used is because it meant that there was an opportunity for more organs to be used to meet the demand for patients who do require them. Additionally, it also opened up the opportunity for discussions to happen between doctor and the family to talk about what would happen here, and again, the family still have the opportunity to opt out. However, some reasons for why some people actually preferred the opt-in system was because it meant that there was more valid and ethical obtaining of consent. Sometimes as part of the opt-out system, relatives or even an individual may not realize that they're part of the organ donation register and they actually didn't want to be in the first place. So this can make it unclear if there actually is consent here. This is something that's really important that you talk about and consider in your interviews, the idea of consent. It's always highlighted though that it's really important to make sure that even under the opt-out system, relatives and the family are fully aware, and the individual themselves are fully aware that they are on the organ donation register and they do have the option to withdraw themselves. The Human Tissue Act of 2004 is essentially a law that overlooks how organ donation occurs and all the events relating to this. The law states that organ donation may occur for an individual, and the individual's wishes will always take priority over the family's wishes, again, even if there's disagreement or agreement. Additionally, this law also prohibits the sale of organs. Hopefully now you have a greater understanding for what are the two possible types of systems, including the opt-in and the opt-out system, that can be used for organ donation, and you can also consider some of the pros and cons for both of these, the ethics, and how this actually plays a role within the UK healthcare system. In order to make sure that you're staying on top of all the content for your interviews, make sure to check out the rest of my YouTube channel, as I have videos on all of the interview content.